Thank you for joining us today. My name is Dr. Kwame Akoto. I am a board-certified Permanente family medicine physician practicing in the Baltimore, Maryland area. I am joined today by my incredible colleagues, Dr. Christina Brown, Dr. Kathy Walcott, and Dr. Heather Williams. We are here today to share the latest information on COVID-19 and what to do if you or someone in your household tests positive. So with that, I will move on to introduce my colleagues today. We'll start with Dr. Brown.
Hi, everyone. My name is Dr. Christina Brown. I'm a pediatrician practicing in the Baltimore area. This is a great topic today. I'm getting a lot of questions this week with the changes in the CDC guidelines about who to test and when to test. So this is great. I have a 3-year-old and 5-year-old. My 5-year-old got vaccinated on her birthday just in December. So also happy to talk about any vaccine questions today as well. Thank you.
Thank you. And we'll move on to Dr. Walcott.
Good afternoon, everyone. My name is Dr. Kathy Walcott, and I am a board-certified family medicine doctor. I've worked at Kaiser Permanente for 20 years, primarily here at the Silver Spring Center, and also in the Physician Care Plus program. And I really enjoy taking care of people of all ages in family medicine. I'm also a mother of 6 young adults. And a true believer in COVID vaccination as an effective tool to prevent COVID disease. I'm happy to share information with you today on any updates that are floating in. You know, things are changing on a day-to-day basis on testing, isolation, and recovery from COVID-19 disease.
All right, thank you. And we'll move on to Dr. Williams.
Hello, I'm Dr. Heather Williams. I am a board-certified family physician. I work virtually with the Physician Care Plus team. Like my colleagues, I'm also a mom. I have twins who turned 5 this past fall. We were eager to get them vaccinated as soon as it was available for their age group. And I'm excited to be here to talk about what to do if you test positive for COVID and to discuss vaccination further.
Thank you so much. So we're really looking forward to your questions today. So if you are on Facebook and watching live, please post your questions in the comment section for us. So I'll get us started. So as we all know right now, the current wave of COVID-19 is really still growing, and putting a strain on our many resources in our healthcare systems. As a community and as a country, we're experiencing a shortage of testing, and many of our physicians and staff have also been impacted by the recent surge in cases. So our resources are stretched thin. If you have been to one of our medical centers recently or called the advice line or had a virtual appointment in recent weeks, we do thank you for your patience. Doctors, nurses, and support staff are working around the clock to take care of patients, and we promise you we are doing everything we can to help our sickest patients. So thank you again for joining us today. We want to answer many of the questions that we've been getting in clinic and elsewhere. We've also written a lot of blogs on our website so that you may find some additional information, and some questions there may be answered as well. So if you have any questions here, we may also take those and add those to an additional blog. We'll post the most relevant blogs in the comments, so please look out there for additional resources. So with that, let's get started with some of the questions that are foremost in people's minds. So Dr. Walcott, if you could start us off here. When do I need to get tested? When is, when patients ask this, what does that mean?
Well, that's a very good question. I hear that all the time. There's no easy answer. The simplest answer is it really depends. If you have symptoms of COVID-19, sore throat, runny nose, coughing, fever, it's time to get tested. This advice applies whether you're vaccinated or not, because as we know, the Omicron variant is affecting people who have been vaccinated. The good news is, though, for those individuals who are vaccinated, the cases tend to be mild. So if you're vaccinated or if you're not vaccinated and you have symptoms, get tested. It gets a little trickier if you do not have symptoms. So this is for the asymptomatic patients. If you are vaccinated and you don't have symptoms, but you were a close contact of someone who tested positive for COVID-19, it's a good idea to get tested about 5 days after that exposure. However, with one caveat, if you and the contact were both wearing masks for the entire duration of your contact, you can actually just watch yourself, monitor for any symptoms that could develop, and not be tested. However, if you are not vaccinated and asymptomatic and you've been in contact with a close person, relative or friend who tested positive, you should definitely get tested 5 days after that exposure, regardless of whether you wore masks.
Thank you so much. And Dr. Williams, can you tell us about tests? What kind of tests would I need?
Absolutely. So at this time in the pandemic, with this massive surge that we're seeing, testing supply is short and appointments can be hard to come by. The most accurate COVID-19 test is the PCR test. Having said that, if you have access to a rapid test, either a home kit, a home test, or a test administered by a drugstore, that is a viable option. If you test positive on a rapid test and you have symptoms, you can assume that you do have COVID. You don't need a follow-up PCR test. A positive test is unlikely to be false. False negatives are far more common. But if you are negative on a rapid test and have symptoms, you really should follow up with other testing to confirm. You might have COVID, the flu, strep, or just a cold. And getting the PCR test, getting tested for the flu or strep as well, with your symptoms can help determine what's going on.
Thank you. And Dr. Brown, moving on from there, we're hearing a lot about people having negative tests on rapids and then positives on PCRs, like she explained. Could you explain a little bit further about that?
Yeah, so just like Dr. Williams said, if you are able to get a rapid test and it's negative, you still want to follow it up with a PCR if you're having symptoms or that known exposure. So if negative, it's not as helpful. You still want to get that PCR, but if it's positive, you take it as true. So a rapid test at home that is positive is truly positive, and you don't need to come to the office to get a repeat PCR to confirm it.
All right, well, there are a lot of challenges out there now. A lot of people are having trouble finding a testing appointment or finding a rapid test. What's your advice for them?
Yeah, there's so many different ways to get tested. So if you have access to a rapid test at home, you can use that. Through Kaiser Permanente, we offer some drive-through testing, also tests within the lab or test pickup kits. So you can check out on the kp.org to see what options are available soonest for you. You can also get tested at any of the community sites. So the health department offers testing, and also there are a lot of new testing facilities set up at a lot of the hospital locations. But what you do not want to do is you do not want to go to an emergency room or an urgent care just to get tested. We want to save those options for our sickest patients that need to be seen.
Thank you for clarifying that. And I know myself seeing patients in clinic, I get a lot of questions virtually about, if they're sick and can't get a testing appointment, what should they do? And what if they do get a test and aren't able to get results after 5 days? So my advice for that is, if you have symptoms, assume at this time, given the surge, that you are going to isolate yourself as if you did have COVID. So you should get plenty of rest, stay hydrated, use over-the-counter medications for pain and aches if you have anything like that, or fever. For most patients, the test result itself isn't going to change our plan in terms of management. Most people are having mild symptoms and they can self-treat themselves at home and isolate according to the CDC guidelines. We do understand that there is frustration due to the lack of availability of testing appointments, and we certainly sympathize. We are patients ourselves. The demand for testing right now is just simply outpacing the supply. So this is not only a challenge locally, but this is a challenge nationally in multiple healthcare systems. So what we want you to do is try to bear with us for these past few months. We've really optimized things in Kaiser Permanente. We've been getting test results back in 24 hours or less. But now with such high demand and people requesting test more regularly, it is taking a little bit longer, sometimes up to 5 days or longer. So since that can take you out of the quarantine period, we really want you to just kind of treat yourself based on your symptoms, since we're trying to process all the tests as fast as possible. So we're working as fast as we can, and as soon as we get you your results, they'll be available immediately on kp.org in real time, the same time that your physician and healthcare team gets it. So you don't need to call or message us. If you have access to kp.org, you can actually see those results in real time. And we do have one more request, which is not to make an in-person appointment necessarily just for testing. Obviously, if you feel like you need care or additional assessment, make those appointments. But if it's just for testing, we just can't accommodate walk-in appointments with our supplies and staffing. And urgent care cannot do that either. We don't have the resources dedicated for that. Those are dedicated for our sickest members who need immediate medical attention. So even though it may be tempting, if you can't find a test, to make an appointment online, to just come in and try to get one on the spot, we're just not able to accommodate this at this point. And we really ask that if you do have questions, utilize our advice line, which is there 24 hours, utilize our secure messaging system, and try to avoid adding additional strengths or resources. So I will ask Dr. Williams, what should I do if I'm a patient and I test positive?
So if you test positive, regardless of the type of test that you take, you should isolate. Isolating means, if possible, confining yourself to a separate bedroom and bathroom in your home. Wear a mask that covers your nose and mouth if you can't avoid others, but again, try to limit any interaction with others unless you need medical attention. Also, remember that you need to inform your close contacts if you do test positive. And if your child is sick, make sure that you've notified their school. Then you need to monitor your symptoms closely, stay well hydrated. A good measure of hydration is making sure that your urine is a light color. Get lots of rest because your body is working hard to fight off this viral infection. If you have pain or fever, you can take an over-the-counter medication like Tylenol, acetaminophen, or another fever-reducing medication. You can also take over-the-counter cough and cold medications for cough or congestion. Make sure that you are following the age-appropriate guidelines. Read the bottle or send us a message, call in to ask before you give those medications to children. It's important to remember that antibiotics are not effective to treat COVID. Antibiotics treat bacteria, and COVID is a virus, so antibiotics won't help. A lot of patients ask us about monoclonal antibodies. The distribution of this treatment is extremely limited, and it's not available within Kaiser Permanente. With the spread of Omicron, this variant is showing that most monoclonal antibody treatments have been ineffective. So keep that in mind. And patients have also been asking about the newly approved oral medications, the molnupiravir and Paxlovid. These are medications that were given an emergency use authorization by the FDA. They treat COVID positive individuals with mild to moderate symptoms who are at high risk of developing severe disease based on their underlying health conditions. At the moment, they are available in extremely limited amounts, and the distribution to pharmacies is regulated by the state health departments. Your doctor would need to weigh the risks and benefits of prescribing these medications for you. They may have side effects, they may interact with some of your other medications, but the good news is that most patients will recover without any of these treatments. Their bodies will fight off COVID on their own. And an important thing to keep in mind, these treatments don't change the amount of time that you need to isolate.
Thank you so much. We have a few questions in the chat. One of the questions is, any thoughts on the use of the Q home PCR test? Any of our docs like to take that question? And I think
what I've noticed is that the home PCR tests tend to be very expensive compared to the rapid tests. So I'm not familiar with that specific brand, but I just know when I have looked to order tests online that the home PCR tests tend to be a bit cost prohibitive. They're very expensive compared to the rapid antigen tests.
I agree. And if you're looking at the rapid antigen test, the FDA actually has a table of all of the approved antigen tests. So if you're looking for a particular brand, you can look on there. We have some additional questions. Will receiving a booster dose register as positive on a rapid test? The answer is no, the vaccine does not contain any virus and should not cause a false positive on a test. Should I get the booster if I've tested positive recently for COVID? Would anybody like to take that?
I can. If you've tested positive, you need to wait at least 10 days before having the booster shot. So wait that entire 10 days, the 5 days we normally say to test if you're feeling sick, or even if you're asymptomatic that you need to be isolated, and the additional 5 days before you schedule your booster.
That's another great point about the boosters as well. I had a family friend recently who had gotten her booster on a Monday. She felt fatigued, a little down, a little bit of a fever. And then later that week, her children who also lived in the home started showing more obvious symptoms of COVID. And she didn't realize that the congestion she was experiencing was not from the booster. She actually was getting sick right around the same time that she got the booster. So if you've had a booster, but you're showing some congestion or cough, that is not from the booster. You should get tested, and you will not be positive just because you had the booster recently.
Thank you. Dr. Walcott, going back to testing, do I need to retest after testing positive?
No, you do not, is the short answer. Retesting is not needed because it's very common for the PCR test to remain positive for weeks, despite no longer being infectious. And the CDC and local health departments recommend the symptom-based strategy for you to stop self-isolating. And that is, it's been more than 5 days since your symptoms began. 2, you've been fever-free for more than 24 hours in a row without the use of any fever-reducing medications like aspirin or Tylenol or ibuprofen. And 3, your symptoms are actually improving and much better. And even after those 5 days, you still need to wear a mask for an additional 5 days. Now, if your employer or your school still requires retesting, we recommend waiting at least 3 weeks from your last test so that there is time for the PCR test to change from positive to negative.
Thank you so much. And Doctors Walcott and Brown, going back to you, what symptoms should I worry about? When should I call my doctor or 911?
So the symptoms of COVID-19 can range very broadly. As you know, you can be completely asymptomatic, or you can have very severe disease requiring hospitalization. So we're here to help you navigate this, but some general things to think about. So thankfully, with the Omicron surge, this virus is tending to show up mostly as cold-like symptoms, so tend to be able to treat with supportive care at home. So for children specifically, when should you call the doctor? So children tend to have higher fevers than adults that tend to last a little bit longer than adults. But if you're having fever more than 100.5 for more than 3 or 4 days, you should contact your physician. But also look at the whole picture. Is my child drinking well? Am I concerned that they're getting dehydrated? So in an infant, you would look to see, are you having at least 3 wet diapers in 24 hours? For an older child, is the urine very infrequent or very dark in color? Also want to look at their breathing. So are they breathing too hard or too fast? So in an older child, you might see them having trouble completing their sentences, needing to take a breath in between as they're speaking, or for a younger child, that they're using more of their extra muscles to breathe, or slight flaring of their nostrils. That's a sign that they're using too much energy to breathe, and they need to be evaluated to check their oxygen, and make sure nothing else is going on, that they don't need other care. So other signs, if they're having worsening or persistent chest pain, you definitely should be seen. So we do have video appointments and telephone appointments that you can utilize for this, or if you're extremely concerned and think you need immediate attention, you call 911, of course. So I also wanted to take a second to talk about the multi-system inflammatory syndrome in children. So, we're talking about the acute COVID infection here, but some people might start to worry about this syndrome that you can see after a COVID infection as well. So if you haven't heard of it, this is the multi-system inflammatory syndrome in children, can occur about 4 weeks or so after after a COVID infection. And it doesn't mean that you had to have had a severe COVID infection. In fact, many people don't realize that they were positive, but we see on antibodies that they did have an infection. So for this, the symptoms can be really broad. Thankfully, it's a very, very rare thing that can happen, but just something you should know about. So if you're seeing fever more than 100.5 for more than 3 days, and along with that, symptoms that can affect the entire body. So much more common with this are some abdominal pain, vomiting, diarrhea. Can also have some redness of the eyes without a lot of discharge. You can have sometimes enlarged lymph nodes in the neck, especially some changes in the mouth. So chapped lips or the tongue, we call the strawberry tongue, that it's very red. You can have inflammation inside of the mouth. So these are some things to look for on the outside, as well as rash that's atypical. So you definitely want to reach out to your physician about this as well. You can send pictures on kp.org, or of course call if you're more urgently concerned, because this can be a severe life-threatening issue. So definitely don't hesitate to reach out if you're seeing any of those things. But thankfully, it's very rare.
Thank you so much. So next question here is, how long do I need to isolate myself? And I'll take this one. It's a question I get often in clinic. So the CDC's most recent guidelines, which, as you all know, just recently changed, are to isolate for at least 5 days and then wear a mask around others for an additional 5 days after that isolation. Now, your job, your employer, or your school, or wherever else may have a different policy than the CDC's policy, but those are the guidelines that we're following. And this is really based on the science. There's been a lot of questions about this. And what we found is that for this type of infection, people are most infectious within the first 2 or 3 days. So after that, the ability to infect others drops rapidly. And that's why it's okay then to end your isolation after 5 days, but still wear your mask just in case. Everyone who's presumed or confirmed positive COVID-19 should stay home and isolate from other people. Day 0 is the first day of your symptoms if you have symptoms, or the first day of your positive test if you're asymptomatic. You should wear a mask around others in the home and in the public for an additional 5 days. And whether you've had a vaccine or not, these guidelines, are consistent for everyone. You should isolate yourself if you have symptoms of COVID-19 while you are awaiting results. If you've been tested, you want to make sure before you end your isolation that you're clear or not. And people with symptoms should isolate even if they don't know if you've been in contact with somebody else with COVID-19. A question that we're getting a lot in the chat here is about reinfection after a natural infection. So both with the vaccine and a natural infection, you're going to develop antibodies. And those will help to be protective in the future against COVID-19. We don't have an exact period in terms of how long that protection lasts. That varies from person to person. But from the data that we do have, it does appear that the vaccine-mediated immunity tends to be more dynamic, it's more robust, and it seems to be longer lasting than the immunity that we're seeing with someone who's had recovery from a natural infection. So even if you've had a natural COVID infection and recovered, it does not mean you cannot be reinfected. So we still do encourage people to get the vaccine for the best protection. Would my colleagues like to add on that?
No, that's right.
All right, so we'll keep moving on here. So Dr. Walcott, how do I end isolation?
So if you test positive for COVID and you're having symptoms, we always say isolate for at least 5 days. I do get a lot of questions though about calculating that 5-day period and what day exactly does that mean I am finished with my isolation. I hear that a lot. Day 0 is the first day you had symptoms or the day you got tested. Okay, not the day you got your results, but the day you actually got tested. Day 1 is the first full day after that, and you can leave isolation after the 5th day. So if you have no fever for 24 hours before that, on that 5th day, and you're not using any fever reducing medicines to keep your fever down, and your other symptoms, whether the runny nose or cough or whatever, are actually improving, then you can proceed to days 6 through 10 of wearing a mask around others and not isolating. One caveat I'd like to add is that the loss of taste and smell that a lot of individuals experience, that symptom may actually last for weeks or months after recovery, and you don't need to delay your isolation period because of that. So in terms of mask wearing, you need to wear a well-fitting mask around others at home and in public for those 5 additional days, days 6 through 10 of your isolation period. If you are unable to wear a mask when you're around others, then you should go ahead and isolate for a full 10 days. Avoid people who are immunocompromised or at high risk for severe disease. Avoid individuals in nursing homes, avoid other high-risk settings, travel in planes, for instance, until after at least 10 days. If you continue to have fever or your other symptoms have not improved after that 5 days of isolation, as I mentioned, you should wait that full 10 days before you end isolation. And at first, we were actually saying don't travel for the first 5 days of the isolation period, but everything is changing on a day-to-day basis. And what we're saying now is, if at all possible, try not to travel even on day 6 to 10 unless you must. If you have to travel on day 6 to 10, wear a well-fitting mask. But if at all possible, try to not travel at all for the full 10 days. Again, don't go to any places in that 6 to 10 day period, even if you're symptom free and have no fever, where you are unable to wear a mask, such as restaurants or gyms, and avoid eating around others at home and at work for the full 10 days after your first day of symptoms or testing.
All right, thank you very much. Dr. Walcott, you touched on this briefly, but when is it safe to travel again?
It is safe to travel again after 10 full days of isolation. Again, just yesterday, we were really saying 5-day isolation period for testing. And in days 6 to 10, you can travel, but wear a very well-fitting mask covering your nose and your mouth for the entire duration of travel. But right now, the better thing to do is to not travel for 10 full days and not go to any places where you are unable to wear a mask, like a gym or a restaurant, or eating with other people.
Okay. And Dr. Williams, can you expand a little bit more? If I test positive for COVID-19 and don't develop symptoms, what's next?
So like people who do have symptoms, you need to isolate for at least 5 days. In this case, though, if you have no symptoms, your day 0 is the day you test positive. And again, not the day you get your results, but the day that the test was taken, the swab was taken. And then day 1 is the first full day after the specimen, after your positive test. You can leave the isolation after 5 full days, just like Dr. Walcott was saying. But again, you have to wear a mask in all settings around all others for the following 5 days. And if you continue to have no symptoms, then after the 10 days, you can go about your normal activities. But if you develop symptoms at any point during that 10-day period, remember, you'll need to follow the guideline for people who develop symptoms. Again, starting that 10-day count with the first day of symptoms.
Thank you. Dr. Brown, a lot of questions for children. We've got a lot of questions about if you have a child or a caretaker who tests positive, how do you keep the other household members safe? And how can you as a parent continue caring for your child if one of you has COVID?
Yeah, this is a great question and definitely something we're getting on a daily basis right now. So, if you get that positive test result for yourself or your child, take a deep breath first, and go back to the basis. You just do your best. So coming back to the basics. So you definitely want to keep washing your hands frequently. Anyone who's over 2 years old should be wearing a mask. So that's the person who is positive or the caregiver should all be wearing a well-fitting mask that covers the nose and the mouth. If you have gloves at home, that can be helpful for changing the diaper of a child who's positive, for example. You want to be careful when you're coming into contact with any bodily fluids. So that can be, urine or stool or saliva or vomit. Parents, we go through everything. So just do your best to wash your hands and continue to wear those masks and stay vigilant. So for an adult or an older teen that is positive, they should really try to stay isolated in their own separate bedroom, try to use a separate bathroom if possible. If you do have to share spaces, you do want to try to disinfect surfaces that are high touch areas. So doorknobs, faucets, handles, light switches, and even electronics. Your phone is maybe not something you think about, but can definitely spread germs in that way. So for parents who are breastfeeding, I get this question a lot. Can I continue to nurse if I'm sick or if the baby is sick? Well, if you're sick or the baby is sick, it's excellent to keep breastfeeding. They're actually getting your good antibodies to help fight this off or to help prevent infection. So if the mom is sick, she should wear a mask, well-fitting mask that covers the nose and mouth while nursing, but also whenever within 6 feet of the child to help prevent the spread. So, just do your best, the best that you can. And, anyone who's been in contact with the sick family member should be tested 5 days after their last exposure to them or sooner if they develop symptoms earlier in that time frame. Every school and daycare, they sometimes have different guidelines on when to return. So definitely check with your school and your daycare if they have any different recommendations, but we can also provide guidance to you on when it's safe to return as well.
Thank you. Dr. Williams, is there any way for me to know whether I have Delta or Micron?
So only a small number of samples are actually sequenced to determine which variant someone has. And that's done by the state public health lab system. And so they're the ones that are following the variants and watching what's going through the community at any given time. Our Kaiser Permanente PCR test and home antigen test won't tell you which variant you have. But the treatment recommendations remain the same regardless of the variant. So even though we all want to know what we have whenever we're sick with anything, COVID or not, the recommendations are the same. Isolate, rest, hydrate, and seek medical care if you have any severe symptoms or if your symptoms significantly worsen.
Thanks so much. So we do have a question from the chat. It is asking, how long can I expect to deal with long COVID? And is there anything that I can do? I was going to pass that question on to Dr. Walcott.
I'm sorry, I didn't see the question. Can you repeat it?
Sure. How long can I expect to deal with long COVID? Is there anything that I can do?
There is very little data around how long you may continue to experience the symptoms of long COVID. I have many patients come in just telling me about the fatigue they're continuing to experience. And unfortunately, there's not a great solution to that. We tell people to make sure they keep their energy up. And this is after they've recovered now. Keep their energy up, continue hydrating, rest, and to try to get a little bit of exercise if they can. Some people, I talk about supplementing with zinc, vitamin C, things like that. But unless you have specific symptoms, there's not much data around any other treatments for it. Does anyone want to add to that?
Sure. I think I usually encourage my patients also to focus on mindfulness. These symptoms we don't know. There's a lot of uncertainty around how long it'll last and whether it'll persist. But you want to really take that time and focus on yourself. For Kaiser Permanente members, you do have access to the Calm app and the MyStrength app that you can access free through kp.org. And I think that's a great opportunity to take that time and use those techniques. So mindfulness, yoga, stretches, things like that. I think it's just great to sort of center yourself. And there are clinical trials that are available around the country. So it will help us, really try to treat people in the future if you're having these symptoms, to look for those clinical trials and see if you can enter them and, help the scientific community get more information so we can, help people in the future as they develop this condition. Any other thoughts from my colleagues? No. All right. So Dr. Brown, I'm going to head back to you here. So you talked a little about this, but for my kids at school, how do I keep them safe?
Again, it's back to the basics. So first, I should mention, getting children 5 years old and up vaccinated. So anybody who's eligible to be vaccinated should be vaccinated. So the vaccine is safe and effective, and I absolutely recommend it. So reach out to your doctor if you have questions about it. That's what we're here for. So, so wearing your mask, so it needs to be a well-fitting mask. I know this can be challenging in children. So I recommend to families to practice at home first, practice while they're sitting watching TV, practice while, between they're playing other games together. So in low stress situations, let them practice wearing the mask to get used to it in short time periods so that when they need to wear it in public, they're ready for it. So again, that's for children age 2 and up. So some families like to send their children to school with KN95s. They make them in different sizes. So the most important is that it fits them well, and it's one that they're going to continue to wear. So you want to talk to them about not touching the front of their mask, not to remove it while they're talking, especially. I've seen people do that. So, and then also washing their hands, wash them again. So before eating, when they've been out playing, that's the best way to help protect them. And then of course, if they're not feeling well, make sure that they know to tell someone, to tell you or to tell the teacher. If they're at school, we have to stay vigilant in order to prevent the spread in schools.
Thank you. And expanding on masks, a question that I'm getting often is what sort of mask to wear, and are cloth masks still useful? So any mask is better than nothing. It does appear that cloth masks are probably less effective during the Micron surge. But we do recommend, if you are using cloth masks, to try to get a multi-layer cloth mask with metal bars on the nose that you can adjust and get a tight fit, adjustable ear straps that you can use to make sure you get a proper seal. The 2 or 3 ply surgical, or what's sometimes called disposable masks, with proper fit over the nose and mouth, do provide more blockage of particles. So that's a little bit more effective. And then the most effective are medical grade, what we call respirators, such as N95s, which can filter up to 95% of particles in the air with a proper fit and seal. Those should be clean and dry and not worn with any additional masks. And whatever mask that you end up getting, if you do get something like a respirator N95 or KN95, you want to make sure that these are not counterfeit. So for N95s, they're certified by the National Institute for Occupational Health and Safety, or NIOSH, and you'll see that actually stamped on the mask. KN95s are certified in China, and again, you'll see the certification there if you buy those online. If I get COVID during a surge, Dr. Williams, how likely is it that I can catch it again? And can I let my guard down after having COVID, stop masking, dine indoors, be more social?
So after you have COVID, it's unlikely that you would be reinfected again within the first 90 days, but it is possible. So remember that. And then after 90 days, your risk of reinfection is higher as your natural immunity that you gained from that infection starts to wane and wear off. It also depends, though, which variant is predominant in the community. That's why it's very important to continue to take the same precautions, especially for people who are pregnant, immunocompromised, or if you have an underlying condition that puts you at risk for severe disease.
Thank you. And Dr. Williams, can you tell us a little bit more about boosters and third doses? There have been lots of questions about those.
Sure. There's been a lot going on recently. So people who are 12 and older, so 12 into adulthood, who have completed the 2-dose Pfizer series, or adults who have completed the 2-dose Moderna series, are now eligible for a booster at 5 months rather than 6 months. And adolescents who are aged 12 to 15 became eligible for a Pfizer booster last week. So 12 and up can now get that booster. Kids who are 5 to 11 who are immunocompromised may now be eligible for a third Pfizer vaccine at least 28 days after completing the initial vaccine series. But again, that's only children who have specific health conditions. So make sure you're checking with your children's physician to ask if they would need that third dose or not. Other questions that we often get are for people who got the J&J vaccine. That was a fantastic option when it came out, because remember, a year ago or even 6 months ago, we didn't all have access to the mRNA vaccine. So if you got the J&J vaccine, remember it was a good option at that time. Now, though, with the mRNA vaccines being readily available, we do recommend that you get a booster of either Pfizer or Moderna if you had the J&J to begin with.
All right, and we've had questions about eligibility for boosters after you've tested positive for COVID. When can you get a booster vaccine? And the answer is just anytime after your isolation period, the sooner the better. So we do encourage you, after you've gotten out of your isolation period, you're feeling well, go ahead and schedule that booster as soon as you can. Dr. Brown, with so many COVID-19 cases, do you feel like the vaccines are doing anything?
Absolutely. The vaccines are helping. Don't you see many people are complaining that they just feel like they have a cold. So even if you catch the virus when you've been vaccinated, it's not a failure of the vaccine. It helped prevent hospitalization and helped prevent death. And so that's our greatest success with it. So that gets me thinking too about, families where if someone tests positive in the family and others are vaccinated, should we all just go ahead and get sick now and get it over with? No, I understand that tendency, but I definitely recommend against that strategy. Everyone can be affected differently. So as you know, some people can be completely asymptomatic, others, it can be life-threatening illness. So you do not want to take that chance. So stick to your masking, isolate as best you can. I know it's hard when taking care of young children, but you will get through this time period. It can feel like forever, but you will get through it. And there is another side to it. So just do your best to prevent the spread. And then again, just vaccinating as many members of the household that are eligible can help prevent the spread. So with your booster, the vaccine is about 75% effective at preventing this virus. So that's the great news. Many people ask about, when will the vaccine be ready for those under 5? We just don't know yet. So the trial for the Pfizer vaccine for those under 5 showed it was not effective enough. So they're doing a trial with a third dose right now. So we will probably know more about that in April. Moderna is also studying this at the same time. So we're hopeful we might learn more about that sometime soon. So to be determined.
Thank you. And briefly, Dr. Walcott, can you tell us about this new variant we're hearing about in France?
Well, from what I understand, it's an emerging situation and we're getting more and more information every day. The World Health Organization and the CDC are keeping a very close tab on it, as they do with all potential new variants. Right now, there's no specific need for concern yet, but stay tuned. But the best prevention is, of course, is to get vaccinated and boosted. You'll hear that theme throughout this entire conversation.
Yes, thank you so much, everyone, for your expertise today. We thank everyone on the call for joining us today. We know there are a lot of questions. We try to get through as many as we could. We know there will be additional questions, and we will, of course, provide additional feedback on our Facebook page and on our website, kp.org. Please remember the healthcare system is strained right now, but we are here working for you. We're trying hard to help all our patients. Thank you for being with us.
Thank you.
Thank you.